I imagine most of the patients that you see have already been through orthodox treatments, and for some reason they don't they have been terminal. Is that fair?
Yeah, we've given up some of them.
Most of them.
That 99% of the people who come see us are actually have seen their doctors, and they have undergone a whole variety of different treatment. We know that. If a person comes in and he has not seen a doctor, I would send them to see a doctor first. I want to get the doctor to diagnose their problem. No, we don't do the diagnosis. We want the doctor to tell us what's wrong with this person first. That's the first thing. All right. So generally, you can see that those people who come here, actually they are written off. I mean, there's nothing else a doctor could do. They say, come and see Chris. You know, no other choice. I always tell people who come and see me, forget about the cure because I cannot cure you. I say, what is important is this. Are you able to sleep? Can you eat? You have no pain. Can you move? So if you can eat, you can move around, you have no pain, what else do you want from me? That's all I ask.
Yes.
What else do you want? You want to live another 100 years? I'm not possible. And you say you want to live forever? That's not possible. If you say you don't want to die, that's also not possible. So I think let's be realistic about it. And I tell you, this strikes a chord with my patient because they were miserable. Either they suffered a lot from chemotherapy. There's no need to tell anything. They will tell you how bad they suffered. The radiation. And when the drugs that they gave. So when they came and they could see that they benefited from it, they're not asking for more anymore in that sense. And with my reinforcement and say, look, I mean, what do we do now? But don't complain after, if you can eat, you can sleep, you can have no pain and all, what else do you want? So I think I want their heart for them.
Yes.
You see, that's the thing.
What about your success rates?
Oh, okay, success rate. As I said, we have been here for 14 years. So I don't want to live in a world of illusion and believe that what I'm doing is great. So I did make a survey among my people who come here, and everyone asked bluntly, what happened if I close cancer care?
Yeah.
And you know, so I got amazing results. You know? Well, we are lost. So I felt that it's bad. I shouldn't do that. So I will not think of closing it any further. At one time I thought I would, but now it's okay. I'm convinced that I'm helping a lot of people. Every patient who come to see us have a record, a file, and it's very detailed, as much detail as possible, and also a tape recording. So I could see the patient, how he looked like even 5 years before this. I kind of went through all the record, and we see this, is that those people, they come, and they will not turn up again for the next 2 or 3 months. Then you know that it's a failure. But then there are people who, after coming for a week, they will come the next week to take more herbs. And of course, when they come to take more herbs, I will still be with them and I will interview them again. I will record their performance, so to say, their progress. So the 3rd week, they will come again and they will come again. And then I could see the progress. So I consider this as success. Not success of cure, but success of that I can do something better for them.
Their satisfaction with your treatment, their feeling that they're benefiting.
Yeah. But what else can they go?
Yes.
What else can they do? You know. So in that sense, I consider that a success. I tabulated this data, calculated them. I found out we have something like 30%, give and take. Now, it's very peculiar. I group we have group of people in Penang. So we end up give and take 30%. Then I look at the record of people who came from Kuala Lumpur. So I have a group of people from Kuala Lumpur who came here. They also had 3%. Not 29, some 28. Then I've got another group of people from the East Malaysia. They also end up give and take almost 30%. So it begins to dawn on me that people seem to react the same way, seem to respond the same way, perhaps have the same attitude, and we end up with a figure of roughly the same. So what does it mean to me? 30%. These are people who are willing to take the extra step to help themselves. The 70% who came to see us actually are shopping. They are asking for magic bullet. They are asking for instant cure. And we come to a stage of being ridiculous at that time. They will be spending $300,000 for medical treatment, or they have been spending 2 years on medical treatment. And when they came to see me, they will ask me, how long can I see your result? They're expecting the result within a week or two. I mean, which is absurd.
Yes.
Absurd. But yes, you have unrealistic people like that. I give and take 30%. And I think I should just devote my time to this 30% of the people rather than 70% of the one that come for shopping.